Thank you for attending today's webinar, Educating African American Mothers on the Importance of Newborn Screening. Please note that all of your phones are muted automatically. If you have any questions during the webinar, please type it into the questions box and it will be answered at the end of the presentation. Our webinar today will be presented by Table for Two, our Baby's First Test 2013 Challenge Award recipient. Our presenters today are Sojourner Mabel Gimmett, Monica Ponder, and Carla Cepillo. To provide you with some background on each presenter, Sojourner Mabel Gimmett is a blogger, educator, social media consultant, brand ambassador, and global advocate for maternal and child health issues. She has been widely recognized for writing and speaking about the joys and challenges of being a stay-at-work mom and connects with moms both new and experienced who have the responsibility of raising a family and maintaining a full-time job. She has been featured in a number of print, online, and television mediums such as Women's E-News, Fit Pregnancy, Real Simple, Fox News, and CNN. She has a BA in Communications from Clark Atlanta University and a MA in Media Studies from Pennsylvania State University. Monica Ponder. Monica Ponder has worked in health communications for nearly 10 years and also leads several community initiatives under the arm of her consulting company, MLP Communications. She's a healthcare researcher and thought leader in reaching vulnerable and high-risk populations. Monica has worked as a health communicator with the Centers of Disease Control and Prevention and a public health liaison epidemiologist with the Fulton County Department of Health and Wellness. Trained in radio, television production, Monica also spent time developing health stories for the local Atlanta Fox News station. She is currently pursuing her PhD in communication at Georgia State University. Carla Cepillo is a nurse educator with more than 25 years of experience in clinical nursing management, care, and public health education in labor and delivery. She has served as the nurse manager of an Atlanta-based OBGYN clinic in a large community health center. Carla volunteers with several community organizations and provides ongoing clinical nursing consultation to organizations within metropolitan Atlanta. Now we offer the floor to our presenters.
On behalf of the Table for Two Foundation team, we are excited to share our work with you today. We will discuss the materials development program that we led with generous support from the Genetic Alliance and Baby's First Test. The goal? Educating African American mothers on the importance of newborn screening. Today we would like to talk with you through our development process, and we will begin with a brief overview of the project and an introduction to the Table for Two Foundation and our work in the maternal and child health arena. Next, we will describe the project implementation, beginning with the theoretical framework and research design, and our strategies for healthcare provider outreach and patient advocate interviews, as well as provide an overview of our lessons learned and key findings that informed product development. We are delighted to share the video and fact sheet with Genetic Alliance, developed with Genetic Alliance and Baby's First Test with you today. Again, welcome from the Table for Two Foundation, or TFT for short. Table for Two is a community-based organization that leads maternal and child health initiatives, especially those targeting communities of color and working mothers. Led by a core team of passionate public health and community advocates, Table for Two is a nationally recognized leader in public lactation room support. Our signature program asks, you wouldn't eat in the bathroom, so why would you expect a baby to? Our community organizing and public health advocacy led to the development of a family play center and lactation room in the world's largest airport, Atlanta Hartsfield-Jackson International Airport, announced in March 2013. Again, on behalf of our core team, Sojourner, Carla, and I, Table for Two Foundation is delighted you decided to share your lunch hour with us today. We bring to the table years of experience in health communications, community organizing, and clinical women's healthcare.
Thank you, Monica. Hi, everyone. My name is Sojourner. Just a friendly reminder that we're using the hashtag #FirstStep on Twitter, so please tweet throughout the webinar using that hashtag #FirstStep. That's #FirstStep. We love supporting public health and healthcare needs for women and children. How we began Table for Two is an example that we hope shows everyday folks that if you see an issue such as a lack of lactation rooms, then you can start a cause, and through hard work and the power of social media, changes can be made. Monica and Carla, they laugh at me, but I like to call it getting fire under your tail feather, to take action and to do something about it, to make a change not only to benefit you, but also to benefit so many others. Table for Two started because working women, including myself, were tired of pumping in public bathrooms to express milk. After creating a lactation room at my previous job, we quickly discovered that it doesn't hurt to ask for what you want. The higher-ups can either say yes or no. If there's an issue that you feel passionately about, then do something about it. We want to thank the Genetic Alliance for acknowledging Table for Two and the work that we do in our local community and also nationally, as well as the opportunity to work on such an important issue as newborn screening. Next slide. We're extremely excited to be celebrating the 50th year anniversary of newborn screening. For more than 50 years, almost every infant in the United States has been screened. So what is newborn screening, you may ask? All 4 million babies born in the United States every year are checked for certain medical conditions. Newborn screening detects treatable conditions in 1 in 300 babies per year. It ensures that all babies are screened for certain serious conditions at birth, and for those babies with the condition, it allows doctors to start treatment before some of the harmful effects happen. Newborn screening is performed soon after the birth of the baby, and in most cases, while you're still in the hospital. All it takes is a few drops of blood and a simple hearing test. After the webinar, learn more about the ABCs of newborn screening at babyfirsttest.org. We were excited to partner with Genetic Alliance in April 2013 and given the opportunity to further our passion for supporting the public health and healthcare needs of women, particularly working with African American mothers such as ourselves on the importance of newborn screening. It's our job as parents to make sure that our babies and toddlers have the best start at life. Now on to the project scope. Please remember that first test saves lives. So please remember that. I want you to take a moment to review this wonderful infographic developed by Genetic Alliance on newborn screening. This graphic can be found on their website as well. Again, as I mentioned earlier, we received a special project funding, a grant in April 2013. We developed culturally appropriate educational materials on newborn screening, targeting African American women and families with the focus on health, literacy, awareness, disparities, early detection, and also prevention. And we engage with minorities serving healthcare providers as well.
So just to dive deeper into our theoretical framework and research design for the project, as aforementioned, we conducted an environmental scan, identified the appropriate theories for stakeholder assessment and message design, utilized partner engagement strategies, and conducted key informant interviews with patients and healthcare providers. Sojourner, Carla, and I will share the results of these activities via thematic analysis, which informed our message and product development. We will close our presentation with an overview of dissemination recommendations. To better understand the materials development needs for newborn screening education, we led an environmental scan. Through our literature review, we found that although newborn screening has been in existence for many decades, the specific roles and responsibilities for how newborn screening is conducted vary between states, and improvements in systems communication are needed. Specifically, stronger linkages are needed between clinical and testing service providers and the patient primary care provider or community-based medical homes. There was strong evidence that described the unique role of the nursing community in managing newborn screening education. Also, healthcare providers showed dissatisfaction and confusion with newborn screening processes. The majority were concerned that the parents may not receive adequate information about their infant's condition, treatment, or prognosis. We really wanted to dig deeper into these perceptions about newborn screening from the clinician community. One study found that no provider reported being confident in his or her own ability to assess how well a parent understands a positive newborn screening result, implying a need for a stronger safety net for patient education and support. Most strongly, serious gaps in patient-provider communication exist, which makes the need for the development of culturally appropriate and tailored health education on newborn screening important to address. For example, previous research showed that there are established gaps in system linkages, provider education, and consumer engagement and knowledge, and that the level of patient engagement varied by income and age. Given this finding, we found few studies that assess the knowledge, attitudes, or beliefs about newborn screening by ethnicity. Interestingly, but not surprisingly, families with a history of genetic illness were more likely to be knowledgeable about the newborn screening processes. Parents described that the inconsistency in the timing of and methods used to inform them about newborn screening and an assessment of nationally available patient education materials on newborn screening showed that most were written at moderate to high literacy levels, not user-friendly, and with few culturally appropriate imagery included. Regarding genetic disorders, birth defects, and developmental disabilities, many disparities exist, and infant mortality is high, emphasizing the importance of early intervention and education for the African American community and strengthening clinical linkages throughout child development. In drawing from the health communications literature, we know that many communities of color have suspicions and lack of trust of the medical establishments and are resistant and wary of the health messages, including messages that can assist in saving lives. For example, in terms of blood donation, it has been well documented that a general mistrust of the medical system by African Americans is blamed in part for their lesser willingness to donate organs. And the same mistrust may contribute to an unwillingness to donate umbilical cord blood. So we identified two theories to inform both streams of our work. One, to develop the organizational strategies that should be used to engage minority communities. The situational theory of publics helps to predict information-seeking behavior among publics or stakeholder groups. The theory has been used practically to determine if publics or your audience use health intervention strategies and how publics perceive those health intervention strategies. This theory helps organizations to better understand the needs and motivations of stakeholder groups and leads to understanding the salient attitudes and identities of those within the public and acknowledging how their cultural identities influence their perceptions, realities, and understanding of those messages. Also, we determined at this point that our goal should be to inform and educate African American women on the importance of newborn screening and prompt engagement or conversation with their healthcare providers. The second theory that we looked at is the stages of precaution adoption process model. It's used to inform message design that will encourage such behavior change. It explains how a person comes to make the decision to be more engaged in the newborn screening process. The theory has been previously applied to osteoporosis prevention, mammography, and hepatitis B vaccination.
Thank you, Monica. And I'm Carla. I am the labor and delivery nurse. I'm not going to say how many years I've done labor and delivery. So after completing the environmental scan and choosing our theoretical framework, our next step was creating our research questions. We needed to get a clear understanding of what and how much African American women knew about genetic testing. We also needed to know the physician's viewpoints or perceptions of newborn screening and how they felt that the current procedure could be improved or even changed. And finally, what can be done to move from being unaware to becoming engaged and actually moving to the point of being proactive. Next screen. So initially our plan was to actually partner with 3 local healthcare organizations, but we reshifted. We focused on minority-serving healthcare providers who actually worked with the patients from the initial prenatal visit all the way until the patient has delivered and goes home. We actually chose Grady Memorial Hospital, which is one of the premier healthcare organizations in Georgia, in the state of Georgia, and it's also a large teaching institution. We chose a neonatologist from Floyd Medical Center, which has a large, it's probably one of the largest neonatal intensive care units in Southwest Georgia, and we actually chose a pediatrician that worked at a large family medicine facility, and myself, a labor and delivery nurse who has worked in labor and delivery in several states and territories of the United States. Next slide. We recruited 10 African American women, all of whom had babies under the age of 1 from various socioeconomic backgrounds. And we actually sent the survey out and sat down and talked to these women. Just we wanted to assess their knowledge about the newborn screening process. We wanted to know what type of experiences that they had during their labor and delivery stay. We also wanted to know if they had any idea of how important newborn screening was, and we wanted to know, did your provider speak with you? Did your doctor come in and explain what was going to be done and how it was going to be done and why it was important to do newborn screening? And we also gained consent from several of the women that we interviewed to participate in the baby's video. Next slide. And it's really interesting because, you know, for research question 1, what are the barriers, perceptions, and beliefs held by African American women regarding newborn screening? And it seemed like it was a common theme. Most people, a lot of the participants were unaware of newborn screening. Some that were aware, well, is that the PKU? Is that when they prick the baby's feet? Or are they being tested for sickle cell? So we had like a common theme. They didn't know. Those who knew didn't know the importance of it, and once they found out why it was so important, they really wanted to be proactive and actually participate and move on from there. We also had some confusion about what's the difference between the testing done when the mom is pregnant between 16 to 20 weeks gestation, or also how much did it cost, you know, would my insurance cover it? And we also wanted to find out when you signed the consent for labor and delivery or consent of care for your baby, did anyone explain to you why the test is being done and how important the test is? Next slide. Next slide. Our second research question was what best practices are recommended by minority serving physicians to improve education, and also targeting gaps found in newborn screening. And a lot of the obstetricians suggested that education should be initiated during the patient's prenatal care, and definitely reinforced when they go in to the provider's office for their 6 weeks checkup. Also, the newborn test is mandated by state laws, but each state has different requirements, so, and also different information, so no one knew who was going to pay. Was it going to be the insurance going to pay? How are we going to be reimbursed? There were some questions about that. Also, I know for the state of Georgia, we actually test for 28 different metabolic and endocrine disorders. Most providers mention newborn screening, but did not go into details with the physician. Most patients assume that that this is something that happens post-delivery, and they weren't engaged. And most women during the labor and delivery process, they don't have the time, and that's not the best time to learn anything. I think the focus then is to have a baby and to have a healthy baby and to move on. And I think one of the major things that we recognized was the major barrier to newborn education is time. When should it be done? Who should do the newborn testing? And one of the things that we also noticed that breastfeeding education is a good model to explain newborn screening benefits. Next slide. Research question 2, what are the best practices recommended by minority serving physicians to improve education and targeting gaps in newborn testing? We found out that we needed to use culturally appropriate terms when explaining newborn screening. Most African American women are familiar with sickle cell disease, and we needed to explain to them, okay, we're going to be testing for sickle cell. We're going to test for PKU. It also affects us as African Americans. You also expect resistance or questions from parents who prefer or support natural organic child care. Oftentimes you find the moms that practice natural or organic child care tend to be very educated and very resistant to newborn screening. One of the things that we noticed too, that hospital personnel should also reinforce or educate African American parents on the newborn screening process and expectations. They needed to know what we're testing for, why we're testing, and to make sure that you follow up with your pediatrician when you're discharged to find out the results of the newborn screening. Most patients do not have enough information about newborn testing to actually ask informed questions. A lot of patients don't know that their baby was tested, where the heel stick or why the sock was placed on and what's going on. We noticed also that most educational material are provided at the provider level, so we needed to make sure that the educational fact sheet was at the point where patients can actually read it and understand it. A few providers were unaware of any newborn screening education collateral. A lot of them didn't know that there were fact sheets. Some thought that the fact sheet was provided by the hospital. That once the patient signed, they also received the fact sheet. And one of the things that we learned was that you needed to encourage patients to determine who their pediatrician was prior to delivery to reduce the delays in newborn screening notification. Because when the mother comes in, she has the baby is pricked. Oftentimes the mom doesn't have a pediatrician. She decides who the pediatrician is going to be after she leaves the hospital, and there's a delay in getting that critical information to the mom. So those are some of our findings.
Thank you, Carla. Question number 3, what recommendations can be made to move African American mothers from unaware of newborn screening and its benefits to engaged and actively involved in the newborn screening process? So how can we make African American mothers more aware? We believe from the results, work with African American parents to target this particular audience to develop patient educational materials. Materials are very important, and people really like to have something to hold on to, when they leave a doctor's office. So educational materials would be extremely helpful. Introduce newborn screening education to expecting mothers early and frequently. So that's something that Carla talked about. Increase consumer education on newborn screening, especially in communities of color. You can provide material in the waiting room, or videos are extremely helpful as well. Again, take-home materials. Use culturally appropriate language, storytelling techniques, and use content written at appropriate literacy levels. Be instructive in patient educational materials. Use frequently asked questions. Everyone likes to go to FAQs. You want to see those frequently asked questions, and those are extremely helpful for anyone. Have a clear call to action. Talk with your doctor to learn more about the newborn screening process and what to expect when your baby arrives. So always ask questions. My mom always says it never hurts to ask questions, so ask questions to your doctor. Next slide. Thematic analysis. This is such an important issue, and not much discussion occurs during the gestational period. So please speak with your doctor about this. For those patients who are engaged, know that a test will occur generally. They may not have enough information to be proactive. Encourage African American patients to select a pediatrician during the prenatal phase. This is something that Carla mentioned earlier. It's really important to know your pediatrician. And also, even after screening occurs, mothers are usually preoccupied. You have so many things going on that recovering from delivery and are also not proactively engaged. You're more concerned about, hey, who is this new little person in my life? Well, it's good, it's such a blessing, but also just make sure that you're engaged and aware of the newborn screening process. Patients care. They may not have the proper knowledge to act. Well, hey, that's why we're here. Now you know that newborn screening is very important. Newborn screening is also top-down, so we ask doctors to also talk to their patients about the importance of newborn screening so they can be also engaged. Key findings. So our key findings from our research, most African American women are not aware of the newborn screening process or state requirements. That's why it's so crucial for us to get the word out and for you all to help us with this. So we appreciate you being here with us today. I also wanted to give a shout out to several of you who are tweeting about first test. So using the hashtag, we really appreciate that. The key findings also, insurance implications for newborn screening are unclear. So be sure to check with your provider. Promoting and educating newborn screening at intervals throughout the gestation process, post-delivery, and in early pediatric visits is essential. Most minority-serving providers were not aware of educational materials in this area. And so it's great for us to have put something together, but we really need to get that disseminated throughout Georgia, but also nationally. Recommend engagement with broader healthcare provider teams. And so those are the key findings that we found through our research.
Thank you. Using the takeaways from our environmental scan and the stakeholder interviews, we developed content and messages for the patient activation video targeting African American consumers. During the development process, we recruited new mothers and engaged minority-serving healthcare providers in script development. The video shoot was held at Grady Memorial Hospital, as Carla mentioned, which is a top trauma center in Georgia and a local public hospital in Atlanta, Georgia. We also developed a fact sheet for use by clinicians and healthcare teams on newborn screening, targeting African American consumers. For the messaging, we utilized broad healthcare messages from Baby's First Test, included a storytelling call-out and culturally appropriate imagery, featured frequently asked questions, and designed the materials to complement the Baby's First Test newborn screening Get the Facts fact sheet, which you saw earlier in the presentation. We paid special attention to the literacy level. The fact sheet was written at a low literacy level, ranking 8.8 on the Flesch-Kincaid grade level scoring. Here's a screenshot of the video and fact sheet. We are happy to announce that the materials will be available at the close of this webinar on the Baby's First Test website. Lastly, we made several in-depth recommendations on a partner outreach and dissemination strategy for the materials. Our recommendations were provided to the Baby's First Test team. As an overview, we recommended hosting webinars with key stakeholders, community groups, and minority-serving physician organizations who support newborn screening to discuss the state of newborn screening education and to disseminate the available patient education materials on the Baby's First Test site. Also, stakeholders should champion system-level strategies to introduce newborn screening education to expecting mothers early and frequently. Many women may not be engaged in the process at the time of birth, but would be open to education during the gestation stage so that they are actively engaged and prepared to follow up with their child's pediatrician later. To make newborn screening a success, stakeholders must gain support from the full healthcare team, including obstetricians, labor and delivery nurses, pediatricians, and neonatologists, everyone that may touch mother and baby. This team-based approach to newborn screening will ensure that patients have the support they need to remain engaged, expectant, and informed. Lastly, Stakeholders should ensure the proper distribution of patient education materials and talking points to healthcare providers, particularly minority-serving providers, in print-ready, modifiable templates, so easily accessible materials. Please make sure that healthcare providers know that these tools are available.
Reflecting on our Table for Two advocacy journey really gives us hope as advocates that change can happen. We sincerely hope that it gives you a spark to continue to create a positive change and help others in your own communities, nationally and globally. We would like to thank Genetic Alliance for believing in us to take on this very important project of newborn screening. Feel free to contact us via email or online. Our contact information is listed on this slide. And we want to thank you so much for joining us today. Talia, back to you to open up for questions.
Thank you for that lovely presentation. We have actually a few questions for you. The first question is, what characteristics were you looking for in the 10 African American women that you recruited for this project?
So Carla, would you like to take that question?
We really weren't looking for any particular thing. I think when we started out initially, we just wanted someone, African American women, that lived in the community that had a baby recently. So we just put it out there, and those were the responses that we got.
Okay, great. Our second question is, what types of questions were asked to these 10 recruited women? If you could provide some type of examples.
Well, some of the things that we asked, where did you deliver? How was your labor and delivery experience? Who delivered your baby? Was it a midwife? Was it a physician? Also, do you know anything? Have you heard about newborn screening? What do you know about newborn screening? What do you know about sickle cell? What do you know about PKUs? Did your physician speak to you about newborn screening? Questions along that line.
Okay. And then also, what were the air dates of the PSA in relation to the study? And where is it available for viewing?
So the purpose of this project was only to develop the materials. So we have handed off the baton to Baby's First Test, and they are the ones leading the dissemination and promotion efforts. Talia can, of course, speak more to this, but it will be available on the Baby's First Test website, and we will be in continued discussions about disseminating it and promoting it and making sure that it's widely accessible to, particularly for a healthcare provider or through healthcare provider networks.
Great. And what were your biggest challenges when you were conducting this project?
A lot of it was just really understanding the scope of the field. I mean, there's just not a lot of published literature on perceptions, barriers, beliefs for minority communities broadly, so not just African Americans, but just broadly. And then also what was available from a patient education material standpoint may not have been at the appropriate literacy level. So it seemed when we started like a potentially daunting, very large project potentially. So we just wanted to really just immerse ourselves in just the state of the field to see what people were saying, what is out there, and really get the ball rolling, at least for a conversation standpoint. Also what was surprising is just really a lot of the physician feedback. So again, this is a patient education materials development activity, but I will say the providers were probably the most informative when it came to product development. Mothers we recruited as a part of the materials development process, and a lot of the questions we asked went into the messaging for the products. But really in terms of implementation, which is the gigantic arm of this project, a lot of providers, really were also not confident in really being able to explain the newborn screening process and ask questions, at least proactively. One provider, particularly one that worked in the NICU, said that she really had not come across, and this is an MD, a culturally appropriate education material for African Americans in her practice. So there's just a lot of opportunity for just education, dissemination, and availability of materials. So even if they're out there, that accessibility quotient is a really big factor. So this was just a very eye-opening experience. We wanted to make sure that we at least knew what was going on, not only in our local community, but also nationally by looking at the literature.
I just wanted to piggyback on what Monica said. This is Carla. One of the things I realized, because I've done labor and delivery in New York, I've worked in California, Missouri, and Georgia, some of the states, and I've always done labor and delivery. And one of the things I realized as a provider, you go into the room, you take the baby, you never really explain, you know, what's going on, what's the procedure while you're taking the baby. And I took all of that for granted, but it actually opened my eyes where I know it's standard practice to not inform the moms about newborn screening. So I think that was one of the things that it actually, you know, the whole survey and the process did for me was to open my eyes about the importance of actually getting the information to the mothers. Especially to me, I think it starts at during the initial prenatal visit and reinforced when the mom is in the hospital and getting ready to go home. That, you know, she leaves that with that information.
Great, thank you. That was a great point that you made. We have one more question. In addition to dissemination of the PSAs, have you given any thought or had any plans of how you will continue this work moving forward?
Well, one of the biggest factors is that this really could be expanded for many audiences. I think one of the questions was criteria for mothers. I mean, really the space was so broad. You know, we really wanted to put out a general call to see what mothers were interested, which may also say a lot, those who are already prompted and really ready to be engaged. But these were also mothers whose children were under a year old. So I think there's an opportunity to do the same type of activity for Hispanic, Latino audiences, to maybe families who have multiple children or who, there's just a lot of different avenues for patient education. I think the literature review is most helpful to determine a strategy for materials development moving forward, because there's just a lack of patient education materials available broadly, but also those that are culturally appropriate to different dynamics. We had a lot of questions about just simple insurance. People think that this may just be a test that they have to. So I think there's just a lot of miscommunication, a lot of opportunities for us to just really clarify some of the expectations around newborn screening. Also, I think some of the other questions were in just the process forward and really expecting it and in the time frame of it, and then just a lot of it. So I think that the point is that we could probably do a lot of expanded efforts to really grow this series of materials. And we hope to work further with Babies First Test to have some of those conversations.
And we have one question that just came in, and it's how do we get labor and delivery nurses aware of why it's important to communicate with parents?
So we mentioned a lot, which we didn't talk a lot about. The dissemination piece was at the end, but one of the findings was that newborn screening is a very top-down process. It's very standard. So because of that, a lot of times it gets into the routine, and this may be something that is just something we check off the box when it comes to a healthcare system. So a huge piece of this, if it's not publicly disseminated, it can be disseminated through hospital and healthcare networks so that everyone, including labor and delivery nurses, but also including nurses that are in obstetrician offices and pediatrician offices, to really know about the issue, some of the challenges, and be more conscious and aware of it. So it's really a system signing on to be supportive, to at least allow their members to know. It could be something as simple as hosting a webinar and making sure that these materials are printed and available at all the labor and delivery floors, and just making sure that as a standard practice, each mother goes home with a fact sheet, or she gets it before she actually, when she actually does her registration for the hospital. So I think having those system conversations of when labor and delivery nurses, just calling them out specifically, but even others on the team should be engaged, is a great conversation that needs to be had.
Great. That's all the questions that we have right now. However, if anyone's interested in connecting with any of our presenters, please feel free to email myself or send an email to info@babiesfirsttest.org, and we can connect you. We thank you for attending our webinar today, and you can view this webinar and other webinars on our website at www.babiesfirsttest.org. This is the end of the webinar, and thank you for your time.